taking home health care to the next level to bring the best possible care to patients. That's the goal of OSF Enhanced Home Care.
This program is just a great example of how we can do something really transformational to get a different outcome for a really complex population of patients by working together. It is a true partnership between our teams, and that's the most gratifying work for our team to be a part of.
That's Brandi Clark, Vice President of Digital Care for OSF OnCall, and I'm Shelli Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. You or a loved one is discharged after a hospital stay and told you need home health services to help keep you from having a setback or possibly being readmitted to the hospital. And nobody wants that. Enter OSF Enhanced Home Care, a newer offering from the OSF HealthCare team, which focuses on making sure our most complex patients receive appropriate care with a goal of keeping them out of the hospital. Joining us to talk about Enhanced Home Care, EHC, are Brandi Clark, Vice President of Digital Care for OSF OnCall, and J.J. Guedet, Vice President of Operations and Strategy for OSF Home Care. Thank you both for being with us. This is a collaboration that's been almost for a couple of years now, a collaboration between OSF Advanced Care and Home Health. What was the impetus behind getting this started?
If you go back to COVID, we had the hospital at home program that was really coming out of Duke University, and UNC Health, which is a neighbor, said, what would be an alternative? We don't want to do a hospital at home, and they were talking about how do we take traditional home health and really beef it up, bring more resources to the table, and try to help on the other side of that patient who's not quite ready to stay inpatient, but might need more questions answered, more frequent check-ins than what a traditional home health group should do. So right at that time, OnCall was just getting started with OSF, so it was a great time for us to connect and sort of start brainstorming, how do we do this, and how do we leverage the technologies of OSF and our care teams in the home to really start bringing more attention as a patient needs it.
Now, when you talk about traditional home health services, what has that traditionally meant for people who may not know?
Yeah, so traditional home health would be you leave your hospital, you need nursing services, you need rehab services in your home. You might be a little bit weak or still sick, not able to transfer to your doctor's office or outpatient rehab. So we actually come to your home and provide the nursing services, the rehab work in your home. With home health, it's termed intermittent, so a couple days a week we're there, 3 days. What we have with this kind of enhanced population with greater need is they need touch points maybe daily or maybe several times a day so that they can thrive in that healing environment of their own home.
So, Brandi, when you hear this, hey, what do you think about collaborating? What did the OnCall team think?
Well, our team is always excited to find new ways that we can use the capabilities we've built over the last 5 years to support patients in, new models of care. So we were really fortunate when J.J. came to us and said, we think we have an opportunity that we had several years of experience under our belt in providing a really robust remote patient monitoring program for really the sort of sickest of the sick patients in the community setting. So not people who are sick enough to be in the hospital, but those who have many chronic conditions and comorbidities and are frequent users of healthcare service. So we really built this program that's staffed by APPs, advanced practice providers, nurses. We have virtual pharmacy that's able to make sure patients are on the right medications. We have a dietitian that can help patients who may need help with their diet as it relates to their chronic conditions. We have counseling services for individuals who may have behavioral health needs. So we were able to take those resources and that infrastructure and apply it to the home health population with just a little tweak of the way our teams interact with each other to take care of those patients. So we can, as JJ said, provide that more frequent connection with patients virtually. We can get their vitals virtually as many times a day as we need, and interact with them via the phone or video, so that then JJ's team really is going into the patient's home when they really need that in-person care.
So what types of high acuity patients are we talking about? You said there are certain patients this is good for, and there's some that it's not. Give me who it's for and who it might not be for.
I mean, I think for home care, we're really looking at the heart failure, COPD, somebody who's dealing maybe with a septic condition and starting to wean off of the high med situation they had in the hospital. Those would probably be the primary. Somebody who has got respiratory concerns, or a caregiver who's concerned about, am I doing the right level of care here? And one of the things that this program does is give a call light function for the patient in the home. Typically, when you're in the hospital, you've got your button, you push it, somebody comes in and checks on you. If you go to a nursing home, you push it, somebody walking by can come in your room. It's not really that way in home care. When you're at your home, you have to pick up the phone, you have to call, you got to get to the right person. With enhanced home care, you push the button and on-call's on the phone with a provider taking care of you in real time. So I think that when you hit those levels of patient needs, it's really helping my staff quite a bit because they're not having to stop what they're doing and leave a patient to go check on a patient.
Well, plus you travel. I mean, home care means you are having to go to a home in person, and there may be a distance between those homes too. So obviously I'm hearing technology here if you're going to push the virtual on-call light. Talk about some of the equipment that happens with this program that is put into the homes to make all of this work.
Sure. So we have a Bluetooth-enabled technology kit that is delivered to the patient's home. So we have a team of digitally enabled community health workers who physically take the kit to the patient's home. They educate the patient on how to use it so that we make sure that they're able to actually fully participate in the program. So that kit may have a scale, it may have a blood pressure cuff, a thermometer, a pulse oximeter, all of those. Once the patient takes their blood pressure, that reading automatically via the tablet that comes with the kit is inputted into our platform. So our clinicians who are monitoring those patients virtually have access to all of that vital information.
And so I'm guessing if they see something that may not look like it's right, do they then reverse flow back to the home care team and say, hey, can you go put eyes on this person or check this out? How does that work?
Yeah, first order of business would be to contact the patient directly, right? Like, did we get a wrong reading? Is something not right? Or, what's really happening with the patient? So they do a little bit of triage. And if we're able to address the patient's needs virtually, we can escalate them to have a virtual visit with our advanced practice provider. And then, yes, if there is something that is needed, we need someone to lay eyes on the patient. The provider identifies that the patient needs some sort of care. That's then when we would connect with the home health team so that they can prioritize getting someone into that patient's home as quickly as possible.
I imagine that's comforting for your staff on the home care side.
Absolutely. You're looking for changes of condition in a subtle way before they become, something that has to go back to the hospital to take care of. So a small weight change, but that happens several days in a row, or a temperature change that's slowly creeping up. It's not bothering the patient yet, but it's going to if we don't take care of it right away. These are the things that enhanced home care brings, where otherwise my team would have to go to the home every day or several times a day. And that becomes a challenge for us caring for all the other patients that are coming, through the doors to see us.
You mentioned the pharmacy services. So I understand, and sounds pretty cool to me. Don't they do an assessment of all the meds? They know what they're supposed to be on, what they're not supposed to be on, because sometimes you gather medicines that you've taken over the course of time. They sit in a cabinet drawer, and you're like, well, I guess I should still be taking that. But that may not be always the case, is it? This helps level set that? Tell me about that.
Yeah, so this is a service that's provided to all of our patients enrolled in our kind of legacy program as well as in the enhanced home care program for the pharmacist to really do that double, triple, quadruple check, right, to ensure that patients are on optimal treatment for their conditions. And we would think that with as many double checks as we have as patients are in the ambulatory setting and as they're in the hospital, that wouldn't be a gap, but sometimes it is. To your point, the patient may be in their home and there's a med there that we didn't even know about. So those pharmacists are able to help us close those gaps and make sure that patients are on really the most optimal treatment. This
sounds like a lot. We hear a lot about care coordination. And so obviously going both ways here. Why is that so important for these patients and even for all patients? The term care coordination we hear a lot about. Why is that so important?
Generally speaking, right, we're talking about patients who have multiple things going on with their health, which means they may have multiple providers, specialties that are involved in their care. And especially when a patient has been admitted to the hospital and now discharging and transitioning back to home, that's really one of the riskiest times for these patients to make that transition back to caring for themselves in their home. So this team really wrapping around the patients and making sure that we have the right follow-up. I mean, that's really what the coordination is. Who do you need to see when and for what reason, and maybe in what order, right, to make sure that you're getting the optimal care. So this team is really looking at that patient holistically to ensure that they're getting that right care in the right place at the right time.
So you have that from the clinical perspective. Best care requires that coordination. But think of the human aspect of a patient. You got all these people giving you advice and doctors telling you what meds you should take and you shouldn't take. Patients are trying to learn how to live independently at home. And so we're trying to wade through that and give them clarity. This is the plan. Everybody's going to be kept in the loop. We're all going to work this plan with you together. So there's really two aspects, the care aspect, but also I use my dad as the example. Dad has the yellow legal notepad out, and he's writing 1 million questions down. And when I leave, somebody else comes in, and all of a sudden he has a whole new set of questions. So we're trying to minimize the confusion of how do I live at home safely and convince them you're going to be okay. That's part of what this enhanced home care feature is. You can connect with the provider who's going to reassure you, oh yeah, that's how you do it. This is when you take that med. It's totally normal that this vital turned up with this reading. You're going to be fine.
And then they're checking in on them every day to make sure that's what's happening. I also hear you, the way as you're explaining it, I would think this would lessen the burden on our skilled nursing facilities, because if we can keep these patients at home, for some people, they discharge out of a hospital, they go to a skilled nursing facility because they need a little bit higher level of care, or maybe they don't have the support at home. This, I would think, gives that opportunity to go home instead, where everybody would much rather recover at home in the comfort of their own home with their friends and family coming in. So is there a lessening of a burden on the skilled nursing facilities as well as on the emergency departments? Because these patients also would come back in through the ED, I would think, if a problem arises.
Mm-hmm.
So I'm going to say the demand is so high for skilled nursing facilities that it may not lessen the way they feel it, but it allows the hospital to leverage them with the right patient. As Brandi talked about, having the right patient at the right level of care, you have the right person at the right time, everybody is able to see more patients. But we're all running at 100 miles an hour. We're pretty much maxed out in all of our resources with the on-call team, the home care team, the nursing home team, the hospital team. But you're getting that throughput to move a little bit faster. That helps everybody in the community really thrive.
And J.J. may not say this, but I know we've seen that the home health team is taking some very sick patients, many of whom maybe the first recommendation was to go to a skilled nursing facility, and the patient wasn't agreeable to that, right? So the home health team is really there to step in and do the absolute best that they can to take care of a patient who might have been better suited to go to a skilled nursing facility. And a program like this really helps them to be able to feel more comfortable and confident taking care of those kind of sickest of the sick patients.
Yeah, you could almost say from a home health perspective, enhanced home care helps us, probably more than it helps anybody else, because it's alleviating that moral distress burden you have about how is this patient going to thrive without me being here every day or several times a day. And this gives that vehicle to do that and that 24/7 access.
And currently, there's a high level of respiratory illness across all of our communities. I don't care where you're listening to us from, across OSF HealthCare communities. And I would think this is beneficial because these patients who are the most vulnerable, the last thing they should be doing is exposing themselves, going back, whether it's to a provider's office or to an emergency department. This, I would think, helps lessen some of that risk, correct?
Yeah, certainly. So very timely question as we are, as you said, seeing increased respiratory illness in our facilities. Capacity is very constrained. And J.J. and I have been just in the last 24 hours engaging in conversations with leaders from our largest facility that is really kind of experiencing the most constraint with capacity, and looking at how can we utilize these same resources, same skill sets, same tools to be able to be comfortable safely discharging a patient from the facility, even maybe a day sooner, to free up a bed for a more acutely critically ill patient that is waiting for that bed across, the state of Illinois.
What are we hearing from, so this involves providers, APBs, there's a primary care component over here after they transition out of this program that we'll talk to in a minute. What are we hearing from the providers, those frontline that are seeing them as part of this program? What's the reaction been?
Yeah, so we've identified a couple of our APPs who are really the primary providers taking care of patients in enhanced home care, and they absolutely love it. The interaction with the home health team and the relationship that we've built to really provide this care collaboratively, I think is really gratifying, and they can see on a daily basis the impact that we're having and can give real examples of patients that had we not been providing the care in this way, this patient would have been showing up in the emergency department, potentially readmitted to the hospital. So just an example of that, we had a patient, one of our earlier patients that was in the program, she had hypotension, so low blood pressure, after being put on a new medication in the hospital. And our team was able to provide advice and guidance to that patient. The provider was able to engage with that patient. And the family felt like if we hadn't had this sort of immediate access to that level of care and advice, their recourse would have been reflexively to just go back to the emergency department.
Yeah, that's your safety net. You know what you're going to get there. So absolutely. And how about from your perspective?
Yeah, from a caregiver in the home perspective, I think about our nurse who is the case manager in a traditional sense. I'm going to bed at night worrying about Mr. Guedet. How is he going to make it through the night? And what's going to happen if something goes wrong in the middle of the night? Now this case manager can sleep. So that's a huge thing, self-care, make sure that I'm ready to go first thing in the morning. I've got a team watching my back. We probably get more feedback about that. It's nice to have the real time so we can be traveling to see another patient who needs us and know that there's a team behind the scenes that's following up with that patient who will call if there's a change of condition and we need to go. And if we don't hear it, then we know things are good. And that is a peace of mind that helps our team. I'd say right now in the Peoria market where we're doing this the most, our culture's at an all-time high. Recruitment is at an all-time high, knock on wood. So that's always exciting that people are wanting to join. People are bringing their friends. That's part of the solution that they talk about. Man, we have support. We're able to do best care for our patients in their home setting.
Because this is a 24/7, 365 program where home care in the past was that a Monday through Friday kind of thing, and you didn't necessarily check in on the weekends unless there was a real high need?
So it's kind of evolved over the last 16 years, if you can believe it. I've been here 16 years. The term is intermittent, non-urgent care. That's what home health is. And you listened to Brandi earlier mention we're getting patients who probably would benefit from a nursing home stay, a skilled nursing facility first for 4 or 5 days. These are coming home. That's not intermittent, and that is emerging care. And so our benefit and the way that we're implementing it in our health system has changed fundamentally. It isn't so much that we've changed, but the way that we're bringing patients in to help this health system requires a much more hands-on, daily, constant interaction. So it's a hardship on the mission partners if we're going to go 7 days a week out to the home at the level that we do currently. So this is a huge, huge win for just our staff. And people forget about that part of it too. I mean, we talk about all of the patients who are inpatient right now, but you have to have the caregivers to provide that care. So there's impacts across the board. So this program currently is primarily in the Peoria and Galesburg areas is where we are.
what are plans, because I know there's always plans for expansion down the road, or how you look at, like you said, bringing this to more people. What are some of the things we're looking at to get this into more places and to more people?
Yeah, so we're really looking at how do we continue to optimize the existing program and expand geography as the home care team serves across all of our OSF geography for this existing population. But then as we think to the future, we're also looking at how can we leverage virtual and digital capabilities to now start looking at how do we layer that in for the lesser acutely ill patients, so that we can really personalize the care to every patient and get the in-person care that's needed when it's needed, which many of those lesser acutely ill patients, maybe they actually need less care in the home than what they're getting today if we were able to provide the virtual and digital support for them. So that's sort of not fully baked and defined yet exactly what that looks like, but we're looking at both ends of the spectrum.
And from home health, I mean, part of it's just evidence gathering. You want to have the outcomes to show what did we achieve when we went to this higher level of touch point. So did we reduce hospitalizations? Did we reduce emergency department visits? Are patients thriving? And what's their feedback as we go along this journey? So some of that is that information gathering right now so that we don't rush off. I think from my team, they want it everywhere now. When you talk to our region CEOs, they're like, when can I have it? It's really just trying to go through the rigor of making sure that we've checked off all of those boxes that we need to along the way so you have a repeatable solution that reproduces the same results that we're getting here in Peoria.
Because one of those things that hospitals are rated on is that 30-day readmission number. So ultimately, it's the best patient care that you strive for. But nobody wants to go back into a hospital. I mean, seriously, who wants to be hospitalized? If you can stay home and get the care, always the great goal. Now, patients don't stay in this program forever, do they? It's not one of these, okay, you're in it in a year from now. There is a time frame. Walk me through that.
Yeah, so I'll start at the high level and then you can get to the specifics. From a home health perspective, we are teaching independence from the day you admit. We are teaching you and your caregiver, your loved ones, how to live at home independently. So really, we want you to be able to get to a place where you could take yourself to your doctor's appointment. You could take yourself to outpatient rehab. You could go see your specialist. That's the goal from the day we start. A typical home health patient is on service for 40, 45 days. And then they transition to their primary care provider who takes over. Enhanced Home Care has a little bit of a different timeline, but we're still on that same trajectory, getting you to independence and comfort with what you're facing so that you can take care of yourself.
Yeah, so the general sort of rule is that most patients are in this program for 30 days. So there are ongoing conversations, interdisciplinary rounding that happens between the home health team and the on-call team. But the goal is to get patients to the level that they're ready to be graduated from the program in 30 days. But if a patient is continuing to have a high level of need, we certainly will extend that length of stay in the Enhanced Home Care program to make sure that we provide the care that the patient needs.
So people who are listening to this, they say, oh, that's a great program. How do I get patient X, Y, and Z in this? Walk me through that process, how somebody actually gets to be a part of this program.
Yeah, so I think your traditional path is your provider recognizes that you have a need greater than what you'd be able to take care of on your own. And because the insurance companies have rules around it, you really need to be homebound, where it takes some effort. It takes other people or assistive devices. You're tired when you have to leave the home and you're like, this is a hassle. I'm almost thinking about not going to my doctor's appointment. That kind of meets that homebound. That's a traditional home health patient. I think that route still stays. Your doc needs to make the referral to home health. When the referral comes over, Brandi's team and my team take a look at it and say, this patient is a little higher level need than what we normally get, and we're going to enroll them in Enhanced Home Care. So it's almost a benefit on our side of we're bringing in the extra resources to achieve their patient goals, and it's going to require this level. You don't typically refer straight to say, oh, I want Enhanced Home Care. Just send them to us and say they have a need in the home and they can't get out to get it anywhere else. It's that simple. you could make a referral to home health today, and then we would call your doctor on your behalf and say, hey, Shelli called us and she needs home health. This is what she said. That doctor says, yeah, I just saw her for that condition. I agree. Let's go ahead and enroll her. It can be that simple.
Is it that simple from your perspective too?
It is. Yeah, you covered it.
Okay. So before we wrap this up, final words from both of you. I will start with JJ. What you want people to know about enhanced home care from your perspective. Final word on the subject.
I mean, we are here really to serve the community. So in the home. And so I think appreciate those patients who allow us to come in as guests in their home. We're doing the absolute best that we can. We have the luxury of working for a great health system with resources, and we're bringing all of that technology and provider access to bear that we can to really keep you home and keep you safe.
I think from my perspective, I would say, our team has the privilege of waking up every day thinking about how are we going to continue to advance our abilities to provide care to patients wherever they may be physically and on their healthcare journey, using technology, using digital tools, using virtual means. And this program is just a great example of how we can do something really transformational to get a different outcome for a really complex population of patients by working together. It is a true partnership between our teams, and that's the most gratifying work for our team to be a part of.
Well, I appreciate it. It's a great program to hear about. Brandi Clark, J.J. Guedet, thank you for sharing it with us.
Thank you.
Thank you.
And thank you for being with us as well for this episode of OSF HealthCare Accelerated. And remember, you can find all of our episodes online at osfhealthcare.org/accelerated.